Assalamu alaikum dear students. Today we will discuss Pharmaceutical Chemistry MCQs part first. Which of the following is an expectorant? Option A, ammonium chloride. B, sodium nitrite. Option C, potassium iodide. And option D, barium sulfate. So the correct option is A, ammonium chloride. Explanation is ammonium chloride act is an expectorant by irritating the bronchial mucosa, which enhances secretion clearance from the respiratory tract. Which of the following compound is used as an antacid? Option A, sodium bicarbonate. B, sodium chloride. C, potassium nitrite. And option D, sodium sulfate. So the correct option is A, sodium bicarbonate. Explanation is sodium bicarbonate acts as a systemic antacid. It neutralizes stomach acid HCl to form sodium chloride, sodium dioxide and water, at providing relief from acidity. Which of the following is an official test for the purity of sodium chloride IP? Option A, sulfate test. B, chloride limit test. C, iron limit test. And option D, arsenic limit test. So the correct option is D, arsenic limit test. The Indian Pharmacopoeia includes limit test for impurities like arsenic to ensure the purity and safety of the pharmaceutical substances like sodium chloride. These tests detect toxic elements even in trace amount. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. Which of the following is used as a systemic alkalizer? Option A, ammonium chloride. B, sodium bicarbonate. C, sodium chloride. And option D, potassium chloride. So the correct option is B, sodium bicarbonate. Explanation is sodium bicarbonate raises the pH of blood and urine, thus acting as a systemic alkalizer. It is useful in conditions like metabolic acidosis. Which of the following compound is used as a protective in pharmaceutical preparation? Option A, zinc oxide. B, ferric oxide. C, magnesium sulfate. And option D, potassium iodide. So the correct option is A, zinc oxide. Explanation is zinc oxide forms a protective barrier on the skin and are commonly used in topical formulations to treat minor skin irritations and diaper rashes. So this is very important MCQs. Which test is used to detect chloride in pharmaceutical substances? Option A, silver nitrate test. B, barium chloride test. C, Nessler reagent test. And option D, phenolphthalein test. So the correct option is A, silver nitrate test. Explanation is in the chloride limit test, silver nitrate reacts with chloride ions to form a white precipitate of silver chloride, confirming the presence of chloride. Which gas is involved when magnesium reacts with hydrochloric acid? Option A, oxygen. B, nitrogen. C, hydrogen. And option D, carbon dioxide. So the correct option is C, hydrogen. The reaction between magnesium and HCl produces hydrogen gas and magnesium chloride. Which of the following is not a halogen containing pharmaceutical compound? Option A, potassium iodide, B, sodium fluoride, C, calcium chloride, and option D, silver bromide. So the correct option is C, calcium chloride. Halogens include fluorine, chlorine, bromine, and iodine, while CaCl2 calcium chloride contains chlorine. It is a salt not typically used as a halogen containing therapeutic agent. So this is very important MCQs. Which salt is commonly used as an electrolyte replenisher? Option A, sodium citrate, B, sodium chloride, C, magnesium sulfate, and option D, zinc sulfate. So the correct option is B, sodium chloride. NaCl is essential for fluid balance and is widely used as an oral rehydration salts and IV fluids as an electrolyte replenisher. Which of the following is used as an antidote for iodine poisoning? Option A, sodium thiosulfate, B, sodium chloride, C, potassium bromide, and option D, ammonium chloride. So the correct option is A, sodium thiosulfate. Sodium thiosulfate acts as an antidote for iodine poisoning and reducing iodine to iodide, which is less toxic and more easily excreted. Which of the following compounds is used as a fluoridating agent in dental products? Option A, sodium fluoride, B, sodium carbonate, C, sodium sulfate, and option D, sodium chloride. So the correct option is A, sodium fluoride. Sodium fluoride is used in toothpaste and drinking water to strengthen enamel and prevent dental caries. Which of the following is not a property of a good pharmaceutical buffer? Option A, maintains pH, B, non-toxic, C, easily oxidized, and option D, compatible with active ingredients. So the correct option is C, easily oxidized. A good buffer should be stable, non-toxic, and compatible with the drug. It should not easily undergo oxidation. Which of the following is used as a radio-opaque contrast medium? Option A, barium sulfate, B, zinc sulfate, C, magnesium sulfate, and option D, ferrous sulfate. So the correct option is A, barium sulfate. Barium sulfate is used in radiography of the gastrointestinal tract due to its high atomic number, which provides excellent contrast in X-ray imaging. Which compound is used in the limit test for iron? Option A, thioglycolic acid, B, diphenylamine, C, potassium thiocyanate, and option D, phenanthroline. So the correct option is C, potassium thiocyanate. Explanation is, in the limit test for iron, potassium thiocyanate reacts with ferric ion to form a red colored complex indicating the presence of iron impurities. Which of the following is used as a water softener in pharmaceutical preparation? Option A, sodium carbonate, B, calcium chloride, C, magnesium sulfate, and option D, sodium chloride. So the correct option is A, sodium carbonate. Sodium carbonate precipitates calcium and magnesium ions from hard water, softening it and making it suitable for pharmaceutical use. Which of the following ions is tested using the flame test producing a yellow color? Option A, sodium, B, potassium, C, calcium, and option D, lithium. So the correct option is A, sodium. Sodium ion impart a bright yellow color to a non-luminous flame, used as a qualitative test for sodium. So this is very important MCQs. Which of the following substances is used as an osmotic laxative? Option A, magnesium sulfate, B, calcium carbonate, C, barium chloride, and option D, zinc oxide. So the correct option is A, magnesium sulfate. Magnesium sulfate is used as an osmotic laxative. It draws water into the intestine, increasing peristalsis and relieving constipation. Which of the following is a gas used as a general in anesthetics? Option A, nitrous oxide, B, carbon dioxide, C, hydrogen sulfide, and option D, ammonia. So the correct option is A, nitrous oxide. Nitrous oxide, also known as laughing gas, is used as inhalation anesthetic, particularly in dental and minor surgical procedures. What is the molecular formula of sodium bicarbonate? Option A, Na2CO3, option B, NaHCO3, option C, Na2HPO4, option D, NaCl. So the correct option is B, NaHCO3. Sodium bicarbonate is NaHCO3 and is most commonly used as an antacid and systemic alkalizer. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. Which of the following is used to perform the limit test for chloride? Option A, silver nitrate, B, barium chloride, C, lead acetate, and option D, potassium chromate. So the correct option is A, silver nitrate. In the chloride limit test, silver nitrate reacts with chloride ions to form a white precipitate of silver chloride, indicating chloride impurities. Which compound is used as a urinary acidifier? Option A, ammonium chloride, B, sodium bicarbonate, C, sodium citrate, and option D, potassium acetate. So the correct option is A, ammonium chloride. Ammonium chloride acidifies urine by increasing the excretion of hydrogen ions in the kidney. Which of the following is a commonly used astringent? Option A, zinc sulfate, B, sodium chloride, C, magnesium hydroxide, and option D, potassium permanganate. So the correct option is A, zinc sulfate. Zinc sulfate has astringent properties and is used in eye drops and lotions to constrict tissues and reduces secretion. Which reagent is used in the limit test for sulfate? Option A, barium chloride, B, silver nitrate, C, lead acetate, and option D, ammonium molybdate. So the correct option is A, barium chloride. So explanation is, the sulfate limit test, barium chloride reacts with sulfate ion to form insoluble barium sulfate as a white precipitate. Which of the following is used as an antidote for arsenic poisoning? Option A, dimercaprol, B, sodium thiosulfate, C, EDTA, and option D, atropine. So the correct option is A, dimercaprol, dimercaprol chelate, arsenic and other heavy metals, aiding in their excretion from the body. Which of the following is not a property of pharmaceutical grade water? Option A, free from suspended particle. B, conductivity within the limit. C, containing antimicrobial preservatives. And option D, free from harmful microorganisms. So the correct option is C, contains antimicrobial preservatives. Explanation is pharmaceutical water must be free from preservatives unless specifically formulated. Regular water for injection must be pure and pathogen free. Sodium thiosulfate is used in iodometry. Is it option A, reducing agent, B, oxidizing agent, C, precipitating agent, and option D, complexing agent. So the correct option is A, reducing agent. So explanation is sodium thiosulfate reduces iodine to iodide, making it a common titrant and iodometric titration. What is the color of the flame produced by potassium ion in a flame test? Option A, yellow, B, brick red, C, violet, and option D, green. So the correct option is C, violet. Potassium gives a characteristic violet flame in the flame test used for qualitative detection. Which of the following is used as an oxidizing agent in the limit test for arsenic? Option A, hydrogen peroxide, B, nitric acid, option C, mercuric chloride, and option D, lead acetate. So the correct option is C, mercuric chloride. In the limit test for arsenic, mercuric chloride paper is used to detect arsenic gas, which changes its color depending on arsenic concentration. Which of the following has a cathode laxative action? Option A, magnesium sulfate, B, sodium nitrate, C, calcium carbonate, and option D, ferrous sulfate. So the correct option is A, magnesium sulfate. Magnesium sulfate increases osmotic pressure in the intestine, drawing water and producing a laxative effect. So this is very important MCQs. Which compound is used in the preparation of effervescent powder? Option A, sodium carbonate, B, sodium bicarbonate, C, sodium hydroxide, and option D, sodium sulfate. So the correct option is B, sodium bicarbonate. Sodium bicarbonate reacts with citric or tartaric acid to release CO2 gas, producing effervescence in powder and granules. What is the role of sodium metabisulfate in pharmaceutical preparation? Option A, flocculating agent, option B, antioxidant, C, alkalizer, and option D, surfactant. So the correct option is B, antioxidant. Sodium metabisulfate act as a preservative and antioxidant to prevent oxidation of drug molecule in solutions. Which of the following is used as detection of carbon dioxide gas? Option A, lime water, B, bromine water, C, barium chloride, and option D, silver nitrate. So the correct option is A, lime water. When CO2 is passed through lime water, calcium hydroxide, it turns milky due to formation of calcium carbonate. Which of the following is an example of deliquescent substances? Option A, calcium chloride, B, sodium bicarbonate, C, barium sulfate, and option D, zinc oxide. So the correct option is A, calcium chloride. Calcium chloride absorbs moisture from the air to the extent that it dissolves in the absorbed water, making it deliquescent. The drying agent used in desiccators is option A, calcium chloride, B, ammonium chloride, option C, magnesium sulfate, and option D, ferric oxide. So the correct option is A, calcium chloride. Anhydrous calcium chloride is commonly used as a drying agent in desiccator due to hygroscopic nature. Which ion imparts a brick red color in a flame test? Option A, calcium, B, lithium, C, potassium, and option D, barium. So the correct option is A, calcium. Calcium ions impart a characteristic brick red color to a flame in flame test analysis. Which of the following is used as a hemostatic agent? Option A, ferric chloride, B, sodium chloride, C, potassium iodide, and option D, ammonium chloride. So the correct option is A, ferric chloride. Ferric chloride causes coagulation of blood proteins and is used topically to stop bleeding. Which gas involves when zinc reacts with dilute sulfuric acid? Option A, hydrogen, B, oxygen, C, carbon dioxide, and option D, nitrogen. So the correct option is A, hydrogen. Explanation is the reaction releases hydrogen gas. This is very important MCQs. Which one is an official method to detect sulfate impurities? Option A, barium chloride reagent, B, silver nitrate reagent, option C, Nessler reagent, and option D, Fehling's solution. So the correct option is A, barium chloride reagent. Barium chloride forms a white precipitate of barium sulfate with sulfate ions used in IP limit test. Which of the following is an emetic agent? Option A, copper sulfate, B, sodium bicarbonate, C, zinc oxide, and option D, potassium nitrate. So the correct option is A, copper sulfate. Copper sulfate is a gastric irritant that induces vomiting and was historically used as an emetic. The color of the precipitate formed in the limit test for chloride is option A, white, B, yellow, C, brown, and option D, blue. So the correct option is A, white. Silver nitrate reacts with chloride ions to form a white precipitate of silver chloride. Sodium phosphate is commonly used as laxative, B, diuretic, C, sedative, and option D, antiemetic. So the correct option is A, laxative. Sodium phosphate increases water retention in the colon, promoting bowel movement. So this is very important MCQs. Which one is a non-systemic antacid? Option A, magnesium hydroxide, B, sodium bicarbonate, C, sodium citrate, and option D, potassium bicarbonate. So the correct option is A, magnesium hydroxide. Magnesium hydroxide acts locally in the stomach and is not absorbed significantly, making it a non-systemic antacid. Which of the following is used in water purification is a disinfectant. Option A, potassium permanganate, B, sodium sulfate, C, ammonium chloride, and option D, sodium acetate. So the correct option is A, potassium permanganate. Potassium permanganate is a strong oxidizer and is used to kill bacteria and oxidize organic matter in water. If you like this video, please सब्सक्राइब माय यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। Which compound is used in halogen therapy? Option A, potassium iodide, B, sodium sulfate, C, calcium carbonate, and option D, zinc sulfate. So the correct option is A, potassium iodide. Potassium iodide supplies iodine, which is essential for thyroid function and is used in halogen therapy. Which of the following acts is a systemic acidifier? Option A, ammonium chloride, B, sodium citrate, C, magnesium hydroxide, and option D, sodium bicarbonate. So the correct option is A, ammonium chloride. Ammonium chloride acidifies blood and urine by promoting the excretion of bicarbonate ions via the kidneys. Thank you for watching my videos.